All right, Chapter 6, the human body. All right, so as we get started with the human body, there's some things that you have to understand, generally speaking. The basic structure, the basic functions of the human body. Now, we're not going to cover every single system, but we are going to cover the systems that we're going to deal with the most. Now, as you gain knowledge, as you gain license level, as you gain field experience, you're gonna get more and more understanding, and it's better if you can identify exactly what system we're talking about, because it's going to dictate your treatment plan. It's going to help you examine the patient based on what they're saying to you, communicate your findings to others, and then really fine-tune that treatment plan that I was just talking about. Some things that you need to know as you talk about some directional terminology, some topographic anatomy, anything towards the middle, towards the sternum, that's called medial. And anything that goes away from that is lateral. So when I say the midline, if you draw a line right down the nose, through the sternum, right down the pelvis to the center of the universe, that yellow line, that's the midline, okay? So if I say you're going to go medially, you're going towards the midline. If you're going laterally, you're going away from that. Now, notice there at the top of the diagram, patient's right and patient's left. If you look at that and say, well, you're right and left, that's not the same as the patient's right and left, okay? Couple of things you need to know. You have the posterior, which is the back side. Now, I find it interesting. They say, so you have posterior backside, or the rear. There's also another term there that you could possibly hear, and that's called dorsal, right? Then anterior, or the front, is the ventral. But if you state anterior and posterior, you'll be in good shape. Now, when we say proximal and distal, proximal means towards the core. So we're talking specifically from the legs and the arms. Proximal means back towards the core, and distal means farther away from the core, right? Distal, distance, proximal, proximity, close in, right? And then finally you have superior, meaning above, closer to the head, and inferior means away from the head, right? Superior up, inferior down. It's important to understand that the standard anatomic position, look here at this guy again, his thumbs are lateral. So that means that the radius is towards the lateral side. And it's important to know that as we start learning systems and locations of the bones and structures and things. Anterior is to the front, posterior is to the back, and midline obviously refers to the imaginary line drawn vertically from head to toe, right down the middle, right? We've already talked about all this. Standard anatomic position, continued. You have the medial closer to the midline, lateral away, proximal closer to the core, distal farther away, superior close to the head, and inferior close to the feet. Okay, so that's some directional terminology to get us started. So now we're going to start off with the systems that we're going to need to know. Number one is the respiratory system. And in the respiratory system, we are bringing oxygen in and getting rid of waste gas, basically carbon dioxide, right? And we have anatomy part of it, which is the structures, and we have the physiology part, which is what makes it work, okay? And so you see here a diagram of the structures of the respiratory system. You have the upper airway, and as it goes down, you get all the way down to the lungs, and we're going to start defining some of that as it gets smaller. Okay, the diaphragm is a huge part of the respiratory system. But as we start our way down, we start from the nose or mouth, the nasal or oral pharynx, and as we move into the back part of the throat, that's the pharynx back there. Then the larynx is right there on top with the voice box in it. Then the voice box the larynx, moves down into the trachea proper, and from there we get smaller and smaller into the alveoli, which is the distal point of the respiratory system. Now, also in this area, you can see that we kind of serve two functions here. There's another pipe that goes down the throat, right? So you have the trachea, the larynx is on top of the trachea, and there's a little epiglottis there that is your gate valve, if you will. Am I going to the trachea or am I going to the esophagus? Two tubes that run down there. Those are the only things that are in there, except a couple arteries and veins that go up and down. You've got your spinal cord in there, but as far as other structures, not much else in the neck. As we terminate distally, we get all the way down, we get into the alveoli. Now this is where physiology occurs, right? So when O2 get in there into the tiny little air sacs called alveoli, then the capillary network that's surrounding those alveoli, they transfer, they do the physiology there. Now what goes on is those two structures, the capillary network is touching just barely the alveoli, and there's a semi-permeable membrane between that. Means some things pass back and forth. Well, what passes back and forth? The gases. And on one side is oxygen, and on the other side, roughly speaking, is CO2. And your body does not like imbalance. And so, because there's more oxygen in the air we breathe in than what's in our blood system, oxygen transfers over through that semi-permeable membrane. Then, CO2, there's more CO2 in our blood system than there is in the air, and so CO2 diffuses across that semi-permeable membrane. Well, how do we get air in there to start with? Well, the respiratory system is respiratory is the main category for inspiration expiration. When I inhale, my diaphragm contracts, the intercostal muscles move up and away, and everything opens, creating a negative pressure in my chest, allowing air to rush in. When I relax, I have expiration going on. All my muscles go back to where they go, and it's like a billows, and air pushes out, right? So inhalation, exhalation, right? I would like to note that inhalation or inspiration is an active process. I'm using energy, and expiration is a passive process. I'm not using any energy. And so that's the respiratory system. Remember, we're talking about what's normal. We'll start talking in later chapters about what's abnormal. Well, then we have the circulatory system, another main system that we'll be dealing with. The heart, the blood, and the blood vessels. Those are the main things of the circulatory system. And we'll know some specific ones here, right? The aorta, the largest artery in the body, and the vena cava, the largest vein in the body. Arteries are in red, veins are in blue. Okay? Now what happens? Well, as the blood passes through the capillaries right across in the lungs, we know that double diffusion happens, and it picks up oxygen and goes back to the heart. Okay? And as it comes back to the heart, then it moves out to the rest of the bodies. So the heart is always pumping blood away and receiving blood from the body. And it also is, the blood part of it is carrying not only oxygen, but nutrients to the cells and picking up their garbage. The red blood cells are the grocery deliverers and the garbage picker-uppers. Okay? And then when we get back to the lungs, well, then we drop off all that garbage. The heart consists of 4 chambers. The upper chambers, there's 4 chambers, 2 upper, 2 lower. The upper chambers are called the atrium, and the lower chambers are called ventricles. The left side pumps out to the body, and the right side pumps out to the lungs. Okay? So right side pumps to the lungs, Lungs then return it to the left side of the heart. The left side of the heart pumps out to the body, and then receives it, and then the body sends it back to the right side, and that's how that goes. They are only in one direction. There's valves in the heart, and there's valves in the veins. And here's just a schematic representation of what I just told you. If you want to remember arteries as always away, arteries are always away, and they are under high pressure. Therefore, they have thick, meaty walls to them, okay? And there are three main places that we check for a pulse. They're the neck, which is the carotid, the groin, which is the femoral. Remember, we're not practicing that in class. And the wrist, which is the radial. Those are the three main places that we go on the adult human being. We also have it on the brachial for the child, infant. And there's just the locations in there, right? Anytime an artery passes over a bone, that's where we'll find a pulse. Now, in the circulatory system, the vessels, we have the arteries, which always go away. Then we have the capillaries. And the capillaries are the smallest. And they are where the double diffusion, where that semipermeable membrane allows for the gases to exchange. In the lungs, it's at the alveoli. In the body, it is in the cells or the muscles or wherever that happens to go. Then as the blood comes back up towards the heart again from the body, we're in the venous system. Now the venous system is a low pressure system. Veins are low pressure, they're very thin, and veins have valves to prevent backflow of blood, especially from the lower extremities, right? So arteries are high pressure, thick walled. Capillaries are the smallest of the vessels. And veins are thin walled that have valves to prevent backflow. And then the third component of the circulatory system, remember we have the heart, we have the vessels, and we have the blood, is the blood. We're talking about the blood now. The blood has four main components. Plasma, which is the water portion of the blood. It's the most fluidic part. You also have red blood cells. Those are what carry the oxygen and the carbon dioxide and the nutrients. Those are your trucks that are taking whatever to wherever they need to be. You have your white blood cells, which are your soldier cells. They are there to protect you. Okay? And then the platelets. Those are the clotters. If there's a rupture to any of the systems, the platelets get involved and try to block everything up so that we don't have excessive bleeding. And then we have the skeletal system. The skeletal system does two things. Number one, it supports the body. If we could even call it the musculoskeletal system, this is what supports the body and makes it go. But right now, let's just talk about the skeleton system. There are 206 bones in the body, and each bone in the body has a name. You don't need to know all of those names. You don't need to know about 20 of those names. So we're just going to work on that for us. But it supports the body, and it protects the body, and it actually does some manufacture of red blood cells. Your bone marrow helps with your red blood cells. So if you look at this diagram, these are pretty much the bones you need to know, right? Clavicle, which is the collarbone. Scapula, which is the shoulder blade. Humerus, which is the long bone of the arm. The ulna is on the medial side of the lower arm when the body's in anatomical position, and the radius is on the lateral side. So ulna, radius, and humerus equal an upper extremity. Okay. Then you have the femur and the patella, which is the kneecap. The tibia, which is the bigger bone in the lower part of the lower extremity, and the fibula, which is the smaller bone. So the femur, patella, tibia, and fibula make up the lower extremity. We also need to know about the pelvis and the vertebral column, the thorax, which includes the ribs, and the kind of the skull, which we call the cranium. Okay. Now, in the skull, we need to know that there are movable parts and non-movable parts, and most of them are non-movable. They're fused bones, and they form a hollow sphere that contains and protects the brain, and it's actually designed to kind of crush in some places to protect the brain. The bone that will be affected the most in the cranium, in the skull, the nasal bones, the mandible, which is the jawbone, and there you have it. That's about it. Maybe some cheekbones and so forth, which are the zygoma, but you don't need to know that name right there. And then you have 33 vertebrae that protect your spinal column, your nervous system, right? Your spinal cord. Now, these spinal vertebrae are stacked on top of one another and are held in place by tons of things. There's discs between them. There's tendons that connect them, the bone to tendons connect bone to muscle, and muscles, which are move things, and ligaments are bone to bone. So there's a lot of structure there. Okay, but as we come down the spine, the spinal cord is in the vertebra. Now, you do need to know kind of the order of this, because the spine is pretty important, because without this, we could be paralyzed or even dead. Cervical spine is that top, is your neck, okay? And those first 7 bones are pretty critical. There's 7 cervical spine bones. Then in the thoracic spine, which is your chest, the back part of your chest, there are 12 of them. And those, if you break through some of those right there, you're talking about paralysis. As you get a little bit farther down, now we're talking about lumbar. That's going to be some pain and maybe some numbness, but not necessarily paralysis. And the sacrum and the coccyx are both fused bones at the bottom, just going to have pain, but they could cause excruciating pain, quite honestly, but not really any deficits as far as movement. And here's just a visual representation. I would, if I was you, know that C-spine, cervical vertebrae are 7, thoracic are 12, lumbar are 5, sacral are 5, fused. They're fused bones. Look at the difference, how they look. There's no discs spacing them. And the coccyx is 4 fused. Now, when we talk about the shoulder girdles, we kind of saw that a couple of slides ago. We're talking about the collarbone, the shoulder blade, and the upper arm, right? These 3 things make up that hinge point to move the upper extremity, right? We talked about what was in the upper extremity already. The humerus, the ulna, and the radius per upper extremity, and then, of course, the wrist and the hand. You have 12 sets of ribs, and they protect the heart, lungs, liver, and spleen. They are your shields. So you'll see them right here listed. And there's different kinds, and you can learn more about that later on. But basically, you have 12 sets of ribs. The lower ones are the ones that are easier broken, especially the 11, 12 ribs. Those are not connected to the sternum and therefore easier to break. So we got to be careful with those. But the little dooflinger hanging down off the sternum is called the xiphoid process. Now that is where if we get a little bit aggressive, we could break that off during CPR. So we're going to be focused right there. The sternum is made up of 3 fused bones. You have the manubrium at the top and the body in the middle, and then that xiphoid process. It might be nice to know those things, right? And right above the manubrium is the sternal notch. So if you're looking at the Adam's apple, that's that bone then on the sternum right below that. That's the manubrium. Of course, the pelvis, we all know the hip bone, right? Those hip bones, they protect the reproductive organs and some of the organs that are down in the abdominal area. Okay? And then, of course, each of the lower extremities contain the thigh bone, which is the femur, and then the lower leg, which is the tibia and the fibia. Kneecap is in there, the patella, and then you have the ankle and the foot. That's your lower extremity. Now, any place where two bones come together with each other is called a joint. Not like a 420, but a joint where we can have some articulation. These are held together by supporting tissues, and again, tendons are connecting bone to muscle, and ligaments connect bone to bone. Between each of these bones is a thin layer of fluid with a sac, and that is lubricant in there. It keeps it nice and squishy so you can move around better. You have a couple different types of joints. You have a fused joint, a hinge joint, and a ball joint. Fused joints are like the sacrum and the coccyx. But the hinge joints, well, now we're talking about like the elbow, right? The ball and socket joints, now we're talking about the femur into the pelvis. So the muscles. So we've talked about respiratory, we've talked about cardiac, we've talked about skeletal. There are 3 types of muscles, and there's only 3, and this is the only slide on the muscular system. Anything that moves the skeleton, anything that causes movement and you can control it, that's called a skeletal muscle. I can control it, it's a skeletal muscle. If I can't control it, if it carries out automatic functions without me thinking, that's called a smooth muscle. And then the only place that you find cardiac muscle is in the heart. Okay? So an example of a skeletal muscle would be a bicep or a tricep. A smooth muscle would be the esophagus, would be the gallbladder, the stomach. You can't control those things, right? And of course, the cardiac muscle is only in the heart. Now, the cool thing about the cardiac muscle is it can start its own heartbeat. So you could have somebody that's missing a head or missing a brain, and they still have a pulse because the heart can take care of itself if it wants to. So if there's not much bleeding, you can actually have somebody alive for a moment. Now, when we talk about being alive, a state of aliveness, there's a brain that operates and controls everything. Our nervous system consists of the brain and the spinal cord, and in many other sensor and motor nerves that are spread out through the entirety of the body. Okay? Sensors. If I feel something, that's a sensory nerve. If I move in response to what I feel, well, that's a motor response. Okay? And these signals go from our sensors all the way to the brain and back down in a manner of very quick. Very, very quickly. Okay? The brain is the body's central computer. Okay? And as we get farther away from the base brain, or what like people like to call the reptile brain, the medulla oblongata, and get up into the cerebellum and into the cerebrum, we get into more thinking and voluntary actions, right? I want to do this. I think that I want to move my arms around, so I'm going to. I'm going to contemplate the universe, right? But also the brain is in charge of involuntary functions. I was just telling you, the medulla oblongata, the base brain, that's where our fight or flight comes from. It's also where we breathe from. That brain is in charge of our breathing. That part of our brain, I shouldn't say we don't have multiple brains, but we have different parts of our brain. And of course, all of these signals are transmitted along the spinal cord in the peripheral nervous system. Digestive system, pretty simple, breaks down food so that we can use it so it goes into the bloodstream and then from there it gets distributed to wherever it needs to go in the form of energy. And food that is not eliminated in waste, or food that is not used, energy that's not used, doesn't go in the blood, is eliminated as waste, as poopy, right? Major organs of the digestive system are located in the abdomen. So when we have damage to the abdomen, maybe we don't have short-term issues, but might possibly have long-term issues. The digestive tract begins in the same place the respiratory tract does, in the mouth, right? And then it goes down into the throat. But in the throat, in the neck, it attaches to the esophagus. It goes behind the epiglottis closes and it goes into the esophagus, then from there to the stomach. Things are broken down there, sent on to the small intestine. Things continue to be broken down there and are absorbed. And when we get into the large intestine, we're absorbing everything else out and taking the water out as well. As we get to the rectum, damn near killed him. Ah! Then we're getting ready to poop this out through our anus, which is the orifice that comes out. And here's a lovely little picture I drew for you. We also have the liver, gallbladder, and pancreas as support for the digestive system. It's not their only job, but they do support. All right, I think this is our last system. It is the gyno-urinary, I call it the reproductive system. It's way easier. But we talk about this for also for getting rid of waste from the system as well. Now, it may pass through the reproductive organs as well. The male reproductive organ, testes, produce the sperm, and the penis delivers the sperm. But the penis also eliminates the waste connected from the urethra from the bladder that comes on out, right? So there's that. Then, of course, the female's got a little bit more to her system. She's got some ovaries in there that kick it through the system. The uterus holds the fertilized egg during pregnancy as it becomes a fetus and then a human creature. The ovaries release those eggs and they travel through the uterus through the fallopian tubes. And then if one way or the other it's coming out, the female reproductive organ, the vagina, the birth canal, it's either coming out once a month in pieces and chunks or after 9 months as a fully formed creature of mass destruction. We also, in the gyno-urinary system, the kidneys are a main player here as they filter extra fluids out and send it down through the ureters to the bladder. Right? Urine flows down the kidney tubes, or from the kidneys through those ureters to the bladder. Bladder collects it, stores it, passes it out through the urethra. Everybody's got a bladder. Everybody's got a urethra. Everybody's got a ureter, whether you're male or female. Probably the largest organ in the body, not probably, it is the largest organ in the body, it is the skin. We call it the integumentary system in other places, but skin is good enough for us. It has 3 major functions. Number 1, it protects us from harmful substances in the environment. It regulates our temperature. And then also houses the nerves so that it transmits information from the outside environment to the brain. Consists of actually 3 layers. This is the fatty layer is closest in, is the most interior. But then you have the dermal layer, the dermis. It's the deep, meaty layer, if you will, of the skin. It's the alive portion. It's where everything is kind of housed. Then you have the epidermis, which is the outer layer of skin. And it consists of basically about 10 layers of dead skin cells. And it's constantly regenerating, pushing up from the outside world. But if I was going to tell you if you were to tell me what are the 3 layers of the skin in the integumentary system, you would say the epidermis is the outer layer, the dermal layer is the middle layer where there's most of everything, your sweat glands and nerve endings and so forth. Then you get into the subcutaneous layer, which is the fat layer. And that's where we have most of our bigger things happening. Okay, now if I was to cut down and I see this yellowy, fatty looking gross stuff, then I've cut through down pretty deep. Okay. Our skin, in the undamaged way, is an effective barrier against bacteria and virus, right? And so if we get stuff on us and we just wash our hands and disinfect, we're in probably good stage. Good shape is what I meant to say, right? But the skin is also used to perceive and sense things. I can touch things, I can feel things, I feel pressure, I can feel pain, and I can feel degrees of hot and cold based on my skin. It's the largest organ of the body. Now, as a person grows and develops throughout their life, things change. In an infant, for instance, the airway is very small and easily obstructed. Now, that could be by swelling or it could be by something that they put in their mouth and they choke on. And we have to deal with a smaller airway. As they get a little bit older, the toddlers have poor coordination and balance, and so they're falling and bashing their faces into things and scraping their knees and yada yada. And as we get to the school-aged time frame, again, we're back to the higher activity and more prone to injuries from things like bicycle and other athletic mishaps. And so you can kind of determine what kind of injuries a patient might have based on their relative age. As we continue on, we get into the adolescent stage, and not only are they awkward and they're still trying to figure out their body because it's still growing, that is where all of the hormones start kicking in and the boy parts and the girl parts start really developing. We call adolescence as the point where puberty, right? Puberty happens. And puberty is defined as underarm hair development in males and significant breast development for females. It's the signal that the body is about ready to be functional enough to reproduce. I didn't say they were smart, but they could do it. They physiologically could do this. They're typically the 13 to 18-year-olds, right? Now, as we get into early adulthood, we're talking anywhere from the age of 20 to 40. And these are the people that are mostly fully developed in all of their systems, and they're cracking along. Now, this is where it might get tricky a little bit. When we get into the middle adult time frame, 41 to 60 years old, systems start breaking down and failing, right? Start going to the doctor more and having fun less, right? And that becomes more and more and more. You know, your vision and hearing might start going away. Cardiovascular and respiratory systems might start having problems. And women experience a shutdown of their reproductive systems in this time frame. Generally between their late 40s and early 50s, they start having a little bit more or less hormones going on there. And so we see that kind of change. Weight gain for all male and females in this time frame. And then as we get to the late adulthood, 61 and older, we really begin to see more systems start to fail and easier to break things, easier to burn things because you can't feel very well, and falls, and mental decline and senility kind of increase, right? So the mental declination and senility increasing. These are things that would make, the elders kind of irritated. So what does that mean physiologically for the vital signs? Well, when we talk about vital signs, there are some normal ranges. And we've already talked in class about how to take vital signs, but we're most concerned about pulse, respiration, and blood pressure. SpO2 is a good indicator as well, but these three right here are the most important, and I like to know what the skin is doing as well. So if we're talking about normal numbers, infants should be at about 100 to 180 beats per minute. And then you see the children 70, 150, and adults are sitting between 60 and 100 beats a minute. That's how fast your heart should be beating when you're resting. Okay. Then you look at the respirations. 25 to 60 for newborns, they breathe really fast. Children and infants, 15 to 30, and then adults, 12 to 20, on a normal, average basis. If I was going to write things down and remember it, this would probably be it, right? Systolic blood pressures. Children, I'm not real concerned of unless they're under the number 80, and with adults, I'm not really concerned of unless they're under the number of 90. Now, there are differences. Have they been exercising? Do they have a fever? Do they have a sickness or illness? Are they under stress? Have they gained weight? Are they abusing drugs? All of these things screw with the pulse rates and may make them go up. Things that decrease your pulse rate and respirations and blood pressure is, are you athletic? Do you train? Right? Do you take blood pressure medicines? Maybe you are abusing illegal drugs too, so it could go either way. All right, so that is Chapter 6, the human body. Here are the top 4 slides of things that you need to know. For the respiratory system, it's the lungs and the airway. For the circulatory system, it's the heart, which is the pump, the blood vessels, which are the pipes, and the blood, which is the fluid. Skeletal system consists of those bones that we talked about. We don't need to know any more than those. Muscular system contains 3 kinds of muscles. Remember these, please. I can control them. They're voluntary, which means I can tell my body to move and it does. Those are skeletal. I can't control them. My body does whatever it does because it wants to. Those are smooth muscles. And the only place that I can find cardiac muscle is in the heart. The nervous system, of course, consists of the brain, spinal cord, and the peripheral nervous system. The digestive system consists of mouth, esophagus, stomach, intestines, liver, gallbladder, and pancreas. The gyno-urinary system consists of the reproductive organs, all right, along with any organ used in the excretion of urine. The skin is the biggest organ in the body and protects the body from the environment. It regulates internal temperature and transmits sensations from skin to nervous system. Vital signs change at different points of a life cycle. So that's Chapter 6. Good luck.